Good afternoon, everyone. I'm Bonifio Angkoy. So, my topic for today it is all about dimensional of development health awareness. So, I am reporter chapter 4 and then I am the first to discuss about communicable diseases. First is HIV. Human immunodeficiency virus is a virus that attacks the body's immune system. Without treatment, it can lead to AIDS, acquired immunodeficiency syndrome. There is no effective cure. Once people get HIV, they have it for life, but proper medical care can control the virus. So, ang HIV nga sakit is nani siya possibility nga mag-control. If ikaw mismo nga naisakit is magpatanaw dayon kanos or magpa-test and then na siya proper medications. If dili nimo ni siya sundon is na possibilities nga makatakot ka sa ubang tao. For example, kanang nakikipag-sex ka sa dili nimo kailangan tao and then kato imong nahilabtan kibali nga girl ba or bakla is matakdan to siya, no? And then dili pa ni siya dali pamation, but pag magluya na imuhang immune system or manghina is dito na nimo ma-feel ang mga symptoms like first is fever, second is headache, and then the third is muscle aches and joint pain, and the fourth rash, and the fifth sore throat and painful mouth sores, and then the sixth swollen limb glands, also called nodes, mainly on the neck, and then the seventh is diarrhea, and the lastly is weight loss. If ma-feel na nimo na siya nga mga symptoms, no, is kinahanglan na jud nimo nga magpa-test, no, basin isa na ka dito sa nga naisakit nga HIV. So, HIV prevention. Anyone can get HIV, but you can take steps to protect yourself from HIV. First is get tested for HIV, and then the second is choose safer sexual behaviors, and then the third is use condoms correctly every time you have sex, and the fourth is limit your number of sexual partners, and the fifth is get tested and treated for STIs, and the lastly is talk to your healthcare provider about pre-exposure prophylaxis. STDs, sexually transmitted infections, also called sexually transmitted diseases. STDs, STIs, venereal. So, ang STIs or STDs is kini usa ka infection nga naay daghang klase like chlamydia, gonorrhea, syphilis, HIV herpes, genital herpes, o HPV. So ang uban jud ani is matambalan gamit ang antibiotics. Kung kini tungod sa bacteria sama sa chlamydia, gonorrhea, syphilis. Apan ang viral nga infections sama sa HIV, herpes o HPV is wala na sila tambal bisan tuod imuhang makontrol ang kanang pagkalat ana nga sakit. So ang example na ko ng STDs is makuha nimo na siya nga sakit through sex sa taong may infection. STDs symptoms. Symptoms of a sexually transmitted infection STI can include first is unusual discharge from your vagina, penis or anus. Second is pain when peeing. The third is itchy genitals or anus. And the last is blisters, sores or warts around your genitals or anus. STDs prevention. First is use condoms or dental dams correctly. Second is get vaccinated. The third is avoid sexual contact if you think you may have an STD. Get tested for STDs. The last is avoid sharing towels or clothes. an anti-smoking campaign launched by a healthy agency. So, ang example jud nako ang anti-smoking no is kana bitaw sigarilyo nga ginabaligya no is di ba na siya picture nga nakatatag dito, di ba? Tapos ang makita dito sa picture is mga sakit no like cancer. So, ito yun na sa mga taga companies para ma-persuade ang mga tao nga paundangan ang pagsigarilyo or pag-control. Republic Act 9211 was passed in 2003 and included three key tobacco control components. First is minimum legal sales age of 18 years. The second is text warnings on cigarette packs. Number 3 is smoke-free public places. In our model, this policy change was coded as number 1 starting in 2004. Otherwise, it was coded as 0 in 2000. So, dengue fever is a serious illness spread by mosquitoes carrying a virus belonging to the Flaviviridae family. Members of this family have 4 distinct types: DEM1, DEM2, DEM3, and DEM4. It is vital to have a proper knowledge about their types, as treatment is given accordingly to create lifelong immunity against the type only. Unfortunately, protection against the other 3 types will be temporary, and if someone gets a secondary infection caused by them, they are at the risk of getting severe dengue fever. Signs and symptoms of dengue. Dengue is manifested by a sudden onset of high fever with severe headache and muscle and joint pains, myalgia and arthralgia. Prevention of dengue. The best way of prevention is to avoid being bitten by mosquitoes. Take note of the following steps. First is use mosquito nets and insect repellent. Second is put screens on doors and windows. The third is refrain from going outdoors during the time of the day when mosquitoes are most active. And the last is remove stagnant water. Cover water containers and change water and flowers vases frequently. Malaria. Malaria is a vector-borne infectious disease that is widespread in tropical and subtropical regions, including the Philippines. So the people get malaria from the bite of an Anopheles mosquito that has been infected by feeding on another person with malaria. The malaria parasite, a plasmodium, then enters the person's bloodstream, travels to the liver, and eventually infects red blood cells, causing symptoms. Malaria can also be transmitted through congenital malaria from a mother to her unborn child, or rarely by blood transfusions or shared needles. Signs and symptoms of malaria. The parasites multiply within the red blood cells and cause anemia, high fever, chills, nausea, headache, diarrhea, and in severe cases, coma and death. Prevention of malaria. Malaria can be prevented by avoiding mosquito bites through the use of mosquito nets and insect repellent, spraying insecticides, and draining standing water where mosquitoes lay their eggs. Cholera. Cholera is an acute intestinal infection caused by ingestion of food or water contaminated with the bacterium of Vibrio cholerae. For example, na po aning cholera is kana ganing tubig na nga grabe kahugaw is muna na siyang bacteria mga Vibrio cholerae. So, pag makainom ang tao ana is may muad siyang sakit like diarrhea o pwede po ma-infection ang iyang kinaian. Signs and symptoms from diarrhea, the patient may also experience muscle cramps. Prevention of cholera. Follow these precautions to reduce the risk of contracting cholera. First is wash hands with soap and water frequently and thoroughly. The second is drink safe water only. The third is eat food that is completely cooked. And the fourth is avoid raw food, street food, and any food from suspicious sources. And the last is observe proper hygiene and sanitation at all times. Avian influenza bird flu. Avian influenza is an infection caused by avian influenza, a virus is found chiefly in birds, but infections can occur in humans. Signs and symptoms of avian influenza. Symptoms of avian flu in humans include fever, cold, sore throat, and muscle aches. Some people may also experience nausea, vomiting, pneumonia, diarrhea, and other severe and life-threatening complications, depending on which virus has caused the infection. Prevention of avian influenza. Consider these precautionary measures to prevent infection. First is wash hands or use alcohol-based hand sanitizer to avoid infection of all kinds. Second is stay away from farms and live animals markets. The third is cover mouth and nose when coughing or sneezing. Number 4 is cook chicken thoroughly. Do not eat raw eggs. And the last is avoid cross-contamination. Do not use the same utensils for both raw meat and other kind food. HIN1. HINI is a flu virus that is also known as swine flu. Signs and symptoms of swine flu. Symptoms of swine flu to humans are similar to those of ordinary flu. Fever, cold, sore throat, runny or stuffy nose, body aches, headache, chills, and fatigue. Some people may experience vomiting and diarrhea. Prevention of H1N1. The best way to avoid influenza infections is through vaccination. Common side effects of HINI vaccines are typical of flu vaccines. They are as follows. Number 1 is flu shot. Soreness, redness, minor swelling at the shot site, muscle aches, low-grade fever, anesthesia. These do not usually last for more than 1 to 24 hours. And the second is nasal spray. Running nose, low-grade fever, vomiting, headache, wheezing, cold, and sore throat. Typhoid fever. Typhoid fever, also known as typhoid, is an acute illness most often caused by the Salmonella typhi bacteria or the Salmonella paratyphi, a related bacterium that usually leads to a severe infection. Signs and symptoms of typhoid fever. People with typhoid fever usually have a sustained high fever. Chest congestion develops in many patients, and abdominal pain and discomfort are common. The fever becomes constant. Other symptoms include poor appetite, headache, body aches, and lethargy. Prevention and treatment of typhoid fever. Typhoid fever can be prevented by drinking safe water only, improving sanitation, and eating well cooked food while it is still hot. Washing the hands often and keeping the surroundings clean will